This is a progress update on a disease concept model for CHAMP1 related disorder. A little bit about me for anyone I haven't met yet. My name is Houvener, and I'm a second-year genetic counseling master's student at Rutgers University in New Jersey. I'm trained to become a genetic counselor, which is an allied health profession with advanced training in medical genetics and counseling to guide and support patients seeking more information about how inherited diseases and conditions might affect them or their families, and to interpret genetic test results based on your personal and family history. So this study thus far was completed in fulfillment of my thesis project for my degree. The study is being done through Rutgers University in partnership with Combined Brain and the CHAMP1 Research Foundation. These are my lovely committee members. You might recognize a couple. So to start off, a disease concept model, or DCM, is a full description of the lived experience of a specific disease. It involves collecting qualitative data from caregivers and/or individuals affected with the disorder regarding their symptoms of greatest concern and the impacts of those symptoms on their lives, and combines this data with the information present in the existing literature. So this is an integral part of the drug development process because it presents a method of prioritization for clinical trial outcomes. Presenting problem here is that there's limited information in the literature on the full impacts of CHAMP1 related disorder on affected individuals and their caregivers. So for example, the literature might include that individuals experience vomiting, but might not describe how that symptom impacts their lives or the lives of their caregivers, such as the need to go to the hospital for treatment or the fear that they experience when the symptom presents. Also, there's no specific treatments or interventions for CHAMP1 related disorder. There's only interventions that exist for specific symptoms. So the perfect purpose of this study is to develop and present a DCM for CHAMP1 related disorder based on review of published literature and qualitative interviews with caregivers and healthcare professionals. So we started off with a full review of the literature to identify concepts related to CHAMP1. Then we completed semi-structured qualitative interviews using a framework developed by Combined Brain, and interviewees were recruited from the CHAMP1 Research Foundation with help from Jeff. And so those interviews were processed as described on the slide. And in order to determine the amount of interviews we need, we are using concept saturation, which is the point at which there are no new themes or concepts arising in the interview. As of right now, we are close, but we still need a few more interviews with caregivers to reach true saturation. We then look at the data to analyze the themes and concepts coming up in the interviews. So moving on to the results from the data we have so far, I do want to mention the disclaimer that these results are subject to change prior to publication with additional interviews and further data analysis, but they're not expected to change significantly. So we have 18 interviews included in the study overall so far, 17 of which are caregiver interviews that cover 17 individuals with CHAMP1. The individuals ranged from under 2 years old to over 18, the oldest of which was 31. And there were a variety of variant types represented. Nonsense was the most common. The majority of individuals were non-Hispanic white. And then there were 21 caregivers involved in the interviews. There was also one healthcare provider interview, but that was not included in the analysis because it was not relevant for the caregiver analysis used to make the DCM. So the concepts were divided into three main categories: symptoms, individual impacts, and caregiver impacts. For symptoms, there were 116 included in the literature, 30 of which were only in the literature. They were not mentioned in any of the interviews. And then 86 were in the literature and then further corroborated by the interviews. There were also 68 new symptoms that were mentioned in the interviews that had not been previously mentioned in the literature, and 12 symptoms were mentioned by over 50% of caregivers. The symptoms were broken up into 18 domains, which are like smaller categories. So here's a graph comparing the frequency of coverage of the symptom domains between the literature, which is in orange, and the interviews, which are in blue. As you can see, there are some significant discrepancies between what types of symptoms are focused on in the literature versus what's most important to caregivers. So then here we have what's called a tree map of all the symptoms mentioned in the interviews. In the tree map, the size of the rectangle in which each symptom is written is proportional to the amount of interviews it was mentioned in. So you can see speech delay, which was mentioned in the most amount of interviews, is the biggest rectangle up in the top left corner. And the symptom rectangles are also color coded by symptom domain. So this can help us visualize the patterns of which symptom domains were discussed most frequently by caregivers and what specific symptoms in those domains were most important. So for example, when I squint and look at the tree map, I notice a lot of orange, which is communication, dark blue, which is behavior, and bright green, which is gastrointestinal, for example. Moving on to individual impacts, these describe how the symptoms impact the affected individual personally. So there were only two individual impacts mentioned in the literature, and those were a NICU stay and educational assistant needed. Both of these were supported by the interviews, and there were 40 new symptom impacts from the interviews that were not mentioned in the literature. Four symptom impacts were mentioned by over 50% of caregivers, and those were overall health impaired, communication difficult to be understood outside the family, engaged socially, and transitioning issues. The individual impacts were broken up into the 5 domains that you see here. If we look at these domains, we see that all caregivers mentioned a social and family impact, while the majority of caregivers also mentioned education impacts, health impacts, and self-care and daily living impacts. Work impacts were mentioned the least, but it's important to note that the majority of individuals discussed were children and therefore would not be of working age yet. There were no caregiver impacts reported in the literature, but we ascertained 53 caregiver impacts that were reported in the interviews. The caregiver impact concepts were split into two categories, the first being caregiver and family burdens, and the second being modifying factors. So caregiver and family burdens describe how caring for an individual with CHAMP1 affects the caregiver and their family. And that's split into 6 domains, which are caregiver effort requirements, daily living impacts, emotional impacts, financial impacts, health impacts, and social impacts. Of the 6 domains, all were covered by over 50% of caregiver interviews. Um, Reproductive and family planning was a separate concept that didn't quite fall under any of the domains, but was mentioned by one of the caregivers. Then modifying factors are external influences that either alleviate or exacerbate the impacts of the condition. Again, these are split into 6 domains, which are access modifiers, family and community support modifiers, work modifiers, health support modifiers, resilience modifiers, and other modifiers that didn't fit into one of the other categories. The caregivers reported that family and community support, as well as access to care, especially for identification of the diagnosis, served as a major modifying factor to their experience caring for an individual with CHAMP1. And work and resilience modifiers were also mentioned by over half of caregivers. So finally, for the discussion, with all the data we gathered from caregiver interviews, certain concepts stuck out as being extremely important to caregivers. So vomiting, specifically CVS, was considered a priority symptom for further research given the severity and lack of effective treatment. Behaviors, especially maladaptive behaviors like yelling and screaming, as well as abnormal social behaviors, specifically attention seeking, are important aspects of CHAMP1 that have profound impacts on the individual and caregivers. And then difficulties with falling asleep and staying asleep were also reported to have a large impact on families. Communication difficulties, specifically speech delay, were a heavy focus of the literature and the interviews, but caregivers also discussed the impacts this can have on affected individuals, especially regarding communicating with individuals outside the family. It's also important to note that caregivers also mentioned use of non-speaking communication. This is a strong indicator that while individuals with CHAMP1 related disorder may not always have the capacity to verbalize their thoughts, they are likely to have relatively high functioning receptive communication and have a strong desire to communicate. Then this is just a graph showing the symptoms mentioned by over 50% of caregivers and how well they were represented in the literature. You can see many of the important concepts I just talked about are severely underrepresented in the literature, including vomiting, um, social behavior, abnormal social behavior, and initiation and maintenance difficulties of sleep. So overall, there was a lack of individual and caregiver impacts reported in the literature, and this study begins to bring those impacts into the light, showing that the symptoms associated with CHAMP1 do greatly impact the lives of affected individuals and their caregivers in many different ways. So more research really needs to be done to address these impacts and help families. In terms of limitations, the lack of diversity of our interviewees and subjects was a major limitation, especially the lack of diversity in race and ethnicity. And there was a limited representation of the full age range in our study. We only had 2 adult subjects, so the data on them is not generalizable. We had a small cohort with an unequal representation of the variant subtypes, and all the caregivers were recruited through the CHAMP1 Research Foundation, which could in itself be a bias, especially for the modifying factors. Finally, for future directions, there should definitely be more research on the differences in manifestations between the types of variants. We tried to look at this a bit, but unfortunately, because of the small sample size and unequal representation of the variants, we don't have good enough data to do true analysis or come to any conclusions. We also need more data on how CHAMP1 progresses as individuals age. So given the rarity of the condition and the fact that it was discovered only 10 years ago, adults are certainly underrepresented in the research on CHAMP1, including in the study. So it's important that further research is done on this for the benefit of the community, as well as to inform treatment of the condition. Thank you for listening, and feel free to contact me if you have any questions.